Hi, and I think we are live. Welcome to this evening's edition of Taking Questions. I am thrilled to introduce to all of you Dr. Shelby Harris, who is an expert in the field of behavioral sleep medicine, as well as the author of the book, A Woman's Guide to Overcoming Insomnia. Welcome, Dr. Harris.
Thanks for having me. I'm excited to be here.
Oh, this is such a great topic. And so many of us who are in perimenopause or menopause find ourselves, just not getting a good night's sleep. Can you tell us a little bit about the things that are disrupting our night's sleep?
I think when we're hitting perimenopause, that stage especially, there's a lot of things that can happen. I mean, women tend to have rates of insomnia at a rate of 3 to 2 in comparison to men. And there are a lot of things that happen, but a lot of it's medical and hormonal. So hot flashes, night sweats happen a lot. Once you start to hit perimenopause, then actually you have more risk of sleep apnea. Things loosen, you
Oh, is that right?
snore more. Snoring is a big one. Then there's also like not just the hot flashes and night sweats, we also often tend to wake up with racing brains. I hear that all the time. I wake up at 2 in the morning, my brain just does not stop. And then I think there's also just more demands a lot of times, especially in this stage of life. So perimenopause can start as early as the late 30s for some women. So, at that stage, and women are having babies later a lot of times in life. So, some women are just going through all these hormonal changes. They have young kids at home, or sometimes they have kids and then they're also taking care of their parents and working. And there's just so many demands with everything in life that it's just a firestorm.
Right, right. I mean, so often, and I wake up all the time. It's actually one of the biggest symptoms that I have. I wake up 2 or 3 in the morning,
Yep.
completely drenched. My
Oh,
my
yeah.
my hair is soaked. I have
Oh,
to flip my pillow over. There
yeah.
are some nights I even have to put an Afghan underneath me. But this is something that we find at the after party, and certainly with Womaness, that is one of the biggest issues that we have. And like you said, you have the hot flashes, the night sweats. You have anxiety. Does alcohol play a part?
Oh, alcohol definitely plays a part. So alcohol, and think about it, like there's also been a pandemic going on. So a lot
And
of
then there's
people are
that.
also like the stress and anxiety on top of all that too. So people are drinking alcohol. And what alcohol tends to do is it's relaxing for us for anxiety, for stress, all that sort of stuff. And some people use it to help them fall asleep. But what it does is it wears off. And then when it wears off, guess what? You have more awakenings or you have much more shallow sleep, or you tend to snore more, which then can influence hot flashes, all that sort of stuff. And we do find that the more alcohol you have before bed, it actually can also influence hot flashes, night sweats, all that stuff.
Mm. What about water? I drink a
Mhm.
lot of water because I'm very dehydrated, but then on
Yeah.
the flip side, I have an overactive bladder.
Yeah.
So what's my relationship with water, especially before I go to bed?
And yeah, so water, we always say limit it within 3 hours of bed, which is hard for a lot of
It's
people.
hard.
I know. So, and a lot of people like I take medication before bed at night. So yeah, I have to. I usually say just have a glass. Like when I say a glass, not this. Like 8 ounces max within 2 hours of bed. Now, one other thing to caution people is that sometimes people will drink a lot of water in the evening because they're super thirsty. If you're not drinking enough during the day, you're like
Hmm.
backloading it
Right.
essentially. So really try to think about mindfully. There are apps, there are all these great things that can remind you. I have an app that reminds me to drink water
Is
throughout the
that
day.
right?
Yeah, it's like literally like drink water every hour. And it's great. It keeps me on top of it so that I'm not super thirsty at night. And then if you're still super thirsty and you have to drink lots at night, talk to your doctor because you could have medication side effects. There might be other things that are causing the thirst.
My first question is, what's the name of the app?
Oh, there's so many of them. I don't even remember. I've had it on my phone for years. It's like a plant. I can look later if people want
No, that's
to.
we'll let them know later because I personally would love to know that, and I'd also love to know how much water should I be drinking every hour?
I mean, it really, I tend to drink about 10% or no, half my body weight in water. So in ounces. So that's kind of the rule. A lot of people say like 8 to 10 glasses. It varies. But if you
Right.
want to like in ounces to like 70-ish ounces of water I
Right.
drink a day. So it's a good amount.
So I know for me, I do have to get up anyway, whether I'm drinking water all day long or I drink it before I got to go to bed.
Yeah.
I got to go to the bathroom. What advice would you give to somebody like me who does get up in the night and has to go to the bathroom? How do I get back to sleep?
So it's normal to wake up a few times a night. That's fine. If you have to wake up once or twice to use the bathroom, okay. If you find that it takes you, like some people like expect that they should go right back to sleep like that. Sometimes it takes 5, 10, 15 minutes. But if it's like a half hour or more, what I usually recommend to people is actually see how many times you're waking up at night. And if you're up for a long time, go to
Yeah.
bed a little later and wake up at the same time. And if you spend, it's weird, counterintuitive, but you spend a little less time in bed, sometimes you wake up and you're just in much more of a deeper sleep that you can go back to sleep a little bit faster.
Right. Right. Well, you talked about that being counterintuitive, and there are so many myths versus facts when it comes to your sleep routine and sleeping through the night. What are some of the biggest misconceptions, especially for women at this stage who are in perimenopause and menopause?
hmm So I think, the biggest, I think the misconception just about sleep in general is that a lot of times people just kind of expect that it's a time that they're going to just have poor sleep from here on in. And I think the wonderful thing is wonderful about Womaness and just I think in just our culture in general is that over the past few years, the education for the public and physicians
Mm-hmm.
perimenopause and menopause has really skyrocketed. There are amazing books out there. There's so much evidence-based literature that I think you don't need to suffer, right? So maybe it's not going to be as deep. Maybe there are things that are going on, but if you're up and you're up for hours, there cognitive behavior therapy, which is what I do for insomnia, is effective. There are so many different types of treatments that you shouldn't suffer in silence. It
Right.
just adjust over time. You need to like actually address it if you're really if you're really struggling.
Right. Because it is building blocks, right? If you don't have a good night's sleep, everything else seems to be affected. Your work, your relationships, that brain fog that so many of us suffer, that seems to be more prevalent when we don't have a good night's sleep. And then if we don't have a good night's sleep, we're anxious about it the next night.
I think just quickly, I think you hit on a point there is that people talk about anxiety and depression, and they often at this stage will end up in psychotherapy for anxiety and depression. That's what I specialize in, all for it. But we often, for years, have ignored the sleep part. So if you work on the sleep with a sleep specialist, guess what? It helps to bolster whatever you're doing in your therapy for anxiety and depression.
Right. Right. Oh, I can imagine. It's all building blocks.
Exactly.
What about that myth where my body can adjust to less sleep over time? Is that true?
No, no, it's really not true. So people have a set need, and as you get older, there's also the myth that like as you get older, you need less sleep. As you get older, no,
Right.
maybe a little, half hour. You tend to nap a little bit more, which tends to happen. It gets lighter, but you don't just adjust over time. You can't fake your body into being a 6 hour a night versus something that might have been 7 or 8 for a long time.
Is there a recommendation that you would have? How much sleep should someone be getting?
It really varies. So it's about anywhere between 6 to 9 hours is that kind of sweet spot for the majority of the population. There's individual variation from person to person. So that's where that 8 comes from, is just because it's
Right.
kind of in the middle. So if you're like getting 6.5 hours, but you feel well rested, you don't feel bothered by it, you feel good most of the day, you might have a dip here and there, which is normal. Maybe you're just a little bit on the shorter end. And then just to like get this ideal of 8 by maybe taking sleeping pills or stuff, like what's the point? You're treating just a number. So it's really going about that 6 to 9 for most people, where you feel the quality is good and you feel well rested and refreshed to go about the majority of your day with a dip.
Is there such a thing as too much sleep?
Yeah, there are some people who have this kind of disorder called hypersomnia, where they could get 10 hours and still feel like it's just not refreshing. There are
Hmm.
issues with that that we definitely treat. So if you never seem to get enough sleep or you like can't like there are some people who just genuinely need 10 hours and they feel better with 10 hours. They're on that extreme outlier side. Yeah.
Right. And so when you wake up at night, so many things happen. So many thoughts are going through your mind, racing. And I had actually read on one of your posts that you cannot expect that part of your brain to be rational at 3 o'clock in the morning. And I know this to be true. I think some of the
Oh,
craziest things, some things that seem so important to me at 3 o'clock in the morning, actually aren't important at all.
right.
Let's talk a little bit about that phenomenon and how do you combat that?
So there was actually just if anybody is on Instagram and all, there was a great New Yorker cartoon that came out a few days that was online a few days ago. It was like Insomnia Jeopardy, and it was like all different categories of things that you think about at night for like $100 to like $1,000. It's like people who've wronged me, financial issues,
Right.
what I had to eat. It was like perfect. So when you wake up in the middle of the night, like I said, your rational brain's not there. It's literally not fully turned on. So, what I encourage people to do is if you tend to have the same thoughts over and over again, and you're like, I already have dealt with it, write it down. Write down, there's nothing I can do, or write down what you can do about it. And when you wake up in the morning or in the middle of the night, just say, I've already thought about it. I need to let it go. The other thing that's really important to do is like we always call it like a brain dump. So you can spend 20 minutes, 10 minutes, an hour before bed getting all the stuff out of your brain. Because whatever you go to bed with on your brain is going to be there at 3 in the morning. So try to get it out beforehand. And if there are worries about if I don't sleep tonight, I won't be able to do XYZ tomorrow, really challenge that during the day when you're more rational. See if it's actually evidence behind some of this stuff, because a lot of times we can do things we just don't think we can. Write it down on a piece of paper. It will be okay. I might be a little slower, but I'll get through the day. And the more I worry about it, the worse I'm going to sleep. And if you put it on paper, it actually can help soften it in the middle of the night for you.
Oh, that's actually great advice. Let's talk a little bit about melatonin.
Yeah.
And, we've heard that is a natural sleep aid. Do you have any advice on this ingredient, especially during menopause?
So menopause, well, melatonin in general, I think it has this, some people use it like it's this cure-all. I think it has its place for sure. And for some women that I've worked with in menopause, they find that it's helpful. Others just don't find it does anything. So it's kind of hit or miss. It's not, just because it's over the counter and people talk about it doesn't mean it actually works. The research shows that it's kind of mixed. So the thing to keep in mind with melatonin, it's not FDA regulated. So you want to be able to go with a brand that you trust, that you know. Some of them are USP certified, which shows that you know that there's a company that kind of looked at it to say this is what's in it. And then when it comes to dosing, a lot of people take way too much. It's naturally made in your brain. So you're taking something that your brain naturally makes. 3 to 5 milligrams an hour before bed is like more than enough. I see women all the time on 10, 20. I had someone, I've had a few people taking 30 or more, and more is just more. And so the thing is, just because it's over the counter, it doesn't mean it doesn't have side effects. So some people feel dizzy or kind of nauseous or a little just kind of groggy in the morning. But if it works for you at lower doses, more power to you.
And what about magnesium?
The same thing in a way. Like there's less research on magnesium and sleep, interestingly, but there are some people that it really does benefit. And so I feel like if it's working for you, more power to you, use it, it's fine. But don't expect like there to be one thing that's going to cure everyone's sleep issue. It usually has to be a bunch, like you were talking about building blocks. You have to have some of the behavioral stuff, and then some of the supplements can help for some people.
So let's talk about our relationship with sleep, sex, and our bed.
Yeah. So
because,
what were you saying? Sorry.
I was just going to say, I've read that you recommend the bed solely for these activities. It's kind of like my toddler when I had toddlers, and I put them in bed, not for time out, solely for sleep. So it seems to me that's the same sort of thinking here. What is the relationship with your bed?
I like that you did that also, that you didn't use it for timeout, because a lot of people do that. So
Yeah.
that's good. Um, the issue is that if you're like, let's take people who wake up. I mean, I do it myself sometimes. You wake up at 3 in the morning and your brain is bah, 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 and you're just so active. If you continue to lay in the bed and you're staying there for a half hour, and you're doing this day after day, your brain, even though we're super smart up here as humans, we're still animals that respond to conditioning theory. So the more that you stay in bed, tossing and turning, thinking about your bed, trying to force yourself to sleep, on your phone, all that stuff, you're teaching your body without realizing that the bed is a place to be awake. So if you only sleep and have sex in your bed, you're really teaching your body that this is all it's for. So I encourage people, if you can't sleep, I don't want clock watching. That's not helpful. If you're getting frustrated about a half hour or so, get up, go sit somewhere else. If you have trouble with walking or you're taking medications that make you a little groggy, at least just sit up in your bed. Do something to pass the time, like reading, listen to music, whatever, adult coloring books. And when you get sleepy, when that happens, go back to sleep. So you're teaching your body bed, sleep, but don't sleep in other parts of your house, because then you're going to like to sleep there more than you do in your bed.
I read today on your Instagram about your relationship with sleep and your sofa, which is very different than your sleep in your bed.
And this fits in here because I get a lot of times women will say to me, when I'm on the couch just before bed, I'm so sleepy. And then the minute I get in bed, boop, my brain wakes up. And that's one of the main reasons why, is because we then lay in bed tossing and turning, trying to force sleep.
So now, with this time of year, we're looking at a lot of stress. We're looking at the holidays. There's just a lot going on. And I had read about a bi-directional link between depression, sleep, excessive sleepiness, and certainly the holidays and the time change can play into that as well.
Yeah. So if you find that you're someone who suffers from depression, oftentimes, and especially like we are talking like seasonal depression, like now I'm starting to see more and more people have it. It's light therapy is very effective for some people and talk with a doctor about how to use it properly. But it's light is really important and also setting a more consistent sleep pattern because what happens is depression can go one way or another, or sometimes both for some people. They can either be really tired but not sleep and have insomnia, but some people actually just sleep more. So they use the bed almost like avoidance and then they just nap and they're just much more drowsy. So it's really important to talk with your doctor because the more you're sleeping, if it's more than usual, that actually can worsen your depression. And then the more you're not getting done because you're sleeping too much, your depression gets worse. And the more depressed you feel, then you want to go to bed more. So it's
Right.
something, if you notice your sleep patterns have really changed and maybe your mood has changed a bit, definitely talk with your doctor.
And so if you are tired during the day and you have said, I've read that you said, do not snack, do not sleep snack. What's the sleep snack? What does that mean?
Yeah, it's a funny term that we talk about in sleep medicine. So when you get up, let's say the reason we always talk about get up at the same time and keep that consistent bedtime wake time, it's really important because if you get up at the same time every day and you, let's say you wake up at 7 a.m., if you stay up from 7 a.m. until your bedtime, let's say 11 p.m., and you don't take any naps, you're going to be good and hungry for sleep at night. But if you take some naps or you doze on the couch, especially in the evening or after dinner, you're snacking on sleep. So you might be hungry enough to go to bed at night, but you're not going to be hungry enough for a full meal. So you might wake up in the middle of the night. So snacking on sleep essentially can interfere with your full appetite for sleep at night. That being said, if you naps are great for some people. So if you want to have a little bit of a snack, but it doesn't interfere with your dinner, then more power to you. Have it. I'm all for it.
Well, is there a certain amount of time that you should take a nap? Because I am a napper and I have this theory, and I don't know if it's right or not, but I call it my 20-minute nap. And I set my alarm for 20 minutes. And
Yeah.
I literally wake up after 20 minutes. And my body is conditioned to go to sleep, take that quick nap, and then I'm awake. If I do more than 20 minutes, forget about it. I'm a hot mess for the rest of the day.
Too big of
So
a meal.
is there too big of a meal? Is 20 minutes good for everybody? Is that just me because that's what my body is used to? Is there a certain amount of time that if you do nap, you should nap for and not go past?
So this is for people who are generally good sleepers overall. So if you're someone who has, say, like that hypersomnia, we were talking about the excessive sleepiness or narcolepsy or anything like that, napping is a much more personalized strategy. But for the general population, if you don't have insomnia and you want to take a nap and it doesn't impact your nighttime, 20 minutes is actually the sweet spot. So you hit it. So I usually tell people, try to do it in your bed if you can. Some people only want to nap on their couch, but 20 minutes, set a timer for 30 minutes to give yourself a few minutes to fall asleep. And then after that, you should wake up. If you take longer than that, often what happens, you get into deeper stages of sleep. So you wake up groggier.
Mm-hmm.
Otherwise, wait a whole hour. It's weird. You have to wait like 20 minutes or an hour and a half because then you finish a full sleep cycle and you can wake up a little bit more refreshed. But I mean, most people aren't taking an hour and a half to nap every day.
No, no. Is there a bewitching hour that, dear God, no matter what, after 4 p.m. or whatever, what is the time where you should not take a nap after that time?
So it's usually about 2 p.m. if you're someone who goes to bed at 10 or 11 at night. So if you're
Mm-hmm.
later than that, then you push it a few hours later. But for the average person, 10, 11 bedtime, 2 p.m. is the cutoff.
Okay, so let's discuss the Shelby Sleep Challenge. What you just had a challenge. What is that challenge, and what can our listeners do?
So I did this last month for October. So every week we had like a new challenge. So you can go to my Instagram site, Sleep Doc Shelby, and on there, every Monday I had a new challenge come out. And the way I tried to do it was like the first week, I just wanted people tracking their sleep with a diary. Like, don't use the watches, just like be more in tune yourself to your sleep patterns. See where, if you're getting enough sleep, if you're not getting enough sleep, if you're very variable with your alcohol use, caffeine, all that sort of stuff, just be aware. And then I built on it every week, very a few things to change every week. So some of like one week I was very focused on the morning in the daytime. One week I was focused on the nighttime. So, try to keep consistency with your bedtime wake time, limit caffeine, get bright light in the morning, movement, exercise, all that stuff is in there. And then the last week was really, if you aren't doing better still, think about these sleep disorders that you might have and talk to your doctor.
That's great. And what would you say your number one tip would be for mindfulness and sleep, especially for somebody who suffers from brain fog?
No, I would say practice it during the day. So the majority of people with sleep problems are using like mindfulness techniques at night to fall asleep to, or they're using the apps, which are all wonderful. Don't get me wrong, but that's already like I find like bedtime for a lot of people is just a stressful time because you're trying to force sleep to happen and you're thinking about the app to try and make you fall asleep or mindfulness. Practice it during the day when you're awake. 1 minute, 2 minute exercise. I think of it like a mental muscle that you're strengthening by going to the gym every day. So if
Mm-hmm.
you start small and you do it during the day, you're going to get stronger with it. So it will help with your focus and attention during the day more and more, and it will generalize. It'll be easier to use it at other points in the day and night.
What about the dreaded cell phone? Having your cell phone, your iPhone, your computer next to your bed, especially so many of us have our phones. It's our alarm clock.
I know that's, I always say to someone like, what do you use for an alarm clock? And they're like, "Oh, my phone." Like I
My
can't even
phone.
think of the number of people who have I have an old school alarm clock. So get it out of the room. And if you have teens and kids who have phones at home, model for them good sleep hygiene. Family charging station outside of the bed. Most parents hate to do this. But the phone, there's debate as to whether the blue light is so bad. I mean, I don't think it's great. I think there's a reason that our insomnia rates have gone up. It might be the blue light that's suppressing your melatonin that your brain makes and keeping you up, but also, what are we looking at? Social media is not always the most relaxing of things. Then you get a text, then you get your email. It's not going to help you wind down. So get it out of the room, half hour before bed at least.
When I wake up, I have an app where I'm doing a puzzle. And so that's probably not the best thing to wake up at 3 in the morning with a night sweat and then start doing my word swipe, trying to find words to. Um,
I mean, I don't mind puzzles actually. I don't mind like
oh, is that right?
yeah, I like easy because then sometimes like people are like I couldn't get it all. I couldn't let it go because I had to solve it. But I don't mind puzzles. I just want the phone out. So I always just say go old school. Get paper. Like get a easy crossword puzzle, word jumble, any of that sort of stuff. Just get it away from the phone.
So tell us about your own personal sleep routine. What do you do when you're getting ready for bed? What do you do if you have to get up in the night or you can't sleep? And then we'd love to hear, are there any helpful items that you use personally? Better pajamas, the bamboo sheets, a sleep mask, a noise machine.
Yeah. So for me, I have an almost 12-year-old and I have a just turned 6-year-old who's in first grade. So, a lot of my life for a number of years has been like little kids. I've been if anybody has younger kids or even teens, I'm very, very strict about getting them on a good schedule because if you set your family on a good schedule, it will help you to be on a better schedule. So that's where it has to start. And then for me, I tech out. I don't have the tech, like, I don't sit there on my phone right at bedtime. I'll watch TV first half hour before my wind down.
Do
And then
you have a TV in your bedroom?
I do have a TV in my bedroom, which most of my patients are like shocked by. But I don't really have it on all the time. When I do use it is when I have to be in my room for some reason, like if I have a cold or I have the flu and I don't want to get out of bed and infect the rest of my family. That's when I have it. But I'm not doing it routinely for hours on end. It's most people like just keep it on a lot of time. That's when it's a
Right.
problem. So I tend to have a TV on elsewhere a little bit beforehand. Then I get in my bed and I actually do before I get in the bed. I've been doing since the pandemic started. I've been working on trying to my flexibility a little bit more. So I'm doing more stretching exercises because I'm a runner. So I've been doing a lot more stretching. I do deep breathing. Then I read a little bit and then I go to bed. I don't put much thought in it. Where I put a lot more thought in, which is interesting, I do it and I dim the lights too. That's a big one in the morning. That's where I'm really consistent. So I'm adamant about getting up at about the same time every morning. I'm an early bird, about 5:45, because I run in the mornings.
Mm-hmm.
Very adamant about that, and I get bright light in the morning, and I do a quick meditation, and I find that that's what really helps to keep me consistent with the morning time.
Oh, that's great. What about helpers like those sleep machines, the noise machines? Do you recommend those?
Yeah, I do. I don't use it routinely for myself when I'm sleeping, but that being said, I have creaky floors and stairs in my house. So if I have visitors from out of town who are coming in, and I can hear them walking down the hall and stuff like that, I just turn on my sound machine in my room and it makes a huge difference.
It
So
does.
that's when I use it. Other products in tech that I tend to use a lot. I'm a huge fan. I don't get paid by them at all. Is the Hatch alarm? So it's a. I don't have it in here. My kids stole the two that I have. So it's a light that comes on. It's a morning light, and you can actually dim it at certain times at night too. And you can set your app. You can set it on the app to be different lights and music or meditations. And it's really pretty too. And it just is next to the bed. And that's what I actually use, or my kids use, for wind down time. And you can have it go off at a certain time. And in the morning, it'll come up and play music and get brighter and brighter, like simulating the sun. Other products that I really love. So I do the old school sound machine. I really like that. But for hot flashes. So I've been having them more and more just over time. So
Welcome to the club.
I know. So, it's not bothersome enough for me at this point where I need to do anything significant for interventions. But I haven't tried them out myself, but there are pajamas that you can get that are sweat wicking. I forget the brand names. I should really look into it. That some of my patients use and they really love them. I really like just a good like cotton paracle sheet for me is really great. They're sweat wicking, cooling. Look for like things that are sweat wicking. There's all this new technology out there when it comes to sheets and pillowcases and bedding that is cooling and sweat wicking. So that's what you'll need to make sure that you have. And the other thing that I really love for patients to do is like look at mattress pads. People don't think about mattress pads so often. So they're really great. And it's just over the past few years, the whole area of like cooling mattress pads has like exploded. So
It's
there's
exploding.
bed jet, there's all different ones. Some of them they range in price. Some of them can be really expensive, but people swear by them. So it's another thing to think about. Some of them actually have like water jets that go under them to like cool it off.
That's really cool. I mean, there are so many companies now that are recognizing this woman in this stage in her life. She needs she needs help, and she needs help with sleep, with the hot flashes, with all of the menopausal symptoms that she's experiencing. Um, what does it mean that you can't fake wake?
So, like, it's basically like, sleep has a purpose. It has a lot of purposes. But one of the things that keeps you awake, right, during the day, it helps with wakefulness. And so, people can do all you want. Like, I have a bad night here and there. It happens. And you ask me what I do when I have a bad night. I try not to lay in bed and stay on my phone. I'm not perfect. It happened from time to time. But if I notice it happening 2 or 3 nights in a row, that's when I get out of bed and I do reading and I do all that sort of stuff. I'm very strict with that. But it's like if you have a bad night, have some coffee, have some caffeine. All those things are great, but it doesn't take away the background of sleepiness that's always there. You might still be tired, but you're like revved up to go. So that's what you can't fake wake means is like there's nothing better than natural sleep that will give you that wakefulness. Nothing is going to give you the same exact kind of feeling.
So, if somebody is having issues, not just one or two bad nights, but actually this is something that is chronic and very, very disruptive in her life, what are the next steps that she should be taking? How can she go about getting help?
Yeah. So the first thing you always do is talk with your gynecologist. If you don't feel like your gynecologist is listening to you and they're not, I mean, there are some that just still aren't recognizing the symptoms and they're negating it. You are the best expert on yourself. So go talk to your gynecologist. If you're not getting listened to, find another gynecologist. Then there are treatments. There are treatments. So things you should do if you're snoring, if you're not sure if the quality of your sleep's great, maybe see a sleep doctor so you can get a sleep study. And you don't have to sleep in a lab all the time for a sleep study. It doesn't mean you're gonna have all the wires on. There are simple at-home studies for a lot of women that can be done. And then there's also non-medication treatments like cognitive behavior therapy for insomnia. So you could get my book, you could get apps for CBTI. And if you're on medications or you feel like you want more personalized of approach, or you just need that plus whatever else you want to work on, finding someone at the Society of Behavioral Sleep Medicine has a great listing of people who do CBT for insomnia, which is an evidence-based, really short-term approach, and it's awesome for a lot of people.
Oh, that's great. Well, Dr. Harris, I have really enjoyed talking to you. Again, this is a subject that is near and dear to my heart. And certainly I know many, many women who are going through perimenopause and menopause. So I'd like to thank you for joining us on taking questions. And
Thank,
I wish you a good night, both figuratively and literally.
Thank you. I appreciate it. And same to you. But thanks for talking. I really appreciate it.
Yeah, take care. Have a good
Bye.
day.
Take care.